My name's Richard Goldberger. I'm an orthopedic surgeon on staff at St. Joseph's Hospital, and I've been practicing out of this office at this location since 1983. I'd say that the most important thing in treating patients with spine disorders is to get a correct diagnosis. And that's what I try to impress on all patients. They're all going to come in with pain of varying types, and my job, so to speak, is number one, make a diagnosis, because only once you've got the diagnosis can you then outline a plan of treatment, whether it be surgical or non-surgical, with the patient. And you have to have a serious spine issue, something that either A, you've exhausted conservative management, or B, it's of a serious enough nature that surgery is really called upon. Once somebody has a problem that requires surgery, as long as you're healthy and can undergo anesthesia, you're a candidate for surgery. It's hard to believe, but 30 years ago when I started my practice, the techniques we were using were the same ones used probably since before World War II, had not changed appreciably. There was no hardware. There was no minimally invasive technique. Nowadays, depending on what the problem is, most of the time we can do the surgery through very tiny incisions, disrupt the anatomy of the spine very little, and do really quite elegant and extensive procedures through these minimal incisions. Minimally invasive spine surgery is a concept that one need not disrupt large amounts of spine anatomy to get to the spine. It's frequently now very easy to actually get to the working area of the spine through very small incisions, small exposures, so that we're not disrupting the flesh of the spine, so to speak. I think the number one question that patients will ask when faced with spine surgery is, what will their recovery be like? How impaired will they be? How much pain they'll be in? How long will it take for them to recover? Newer techniques have really minimized the disruption of their lives. The post-operative pain is much less. Freedom of motion comes back extremely quickly, so that patients frequently will be mobile the same day, leave the hospital in 1 to 2 days, and really be able to carry on with their activities of daily living almost without interruption following even major spine surgery. Well, anybody's life will change dramatically if they've been in pain and they're no longer in pain. They'll have freedom of motion. They may be released from the need for walking aids or daily medication ingestion. They'll be able to enjoy the things they haven't enjoyed for probably many years. St. Joseph's Hospital is a very large institution. They have the most sophisticated equipment, and they have a lot of redundant systems. I think that the public must understand that when we do surgery, we're frequently called upon to circumstances we can't predict, and we need a lot of backup systems in place. And that's the advantage of a large institution like St. Joseph's Hospital.